Good evening. This is Jason Brusky. I'm an RN and patient navigator at KSB Hospital. Thanks for joining me tonight, and we're going to talk about Medicare supplements, sometimes known as MediGap plans. I'm going to show you how these can help you survive the rising cost of healthcare and reduce the stress of paying for healthcare when you have to worry about what you cannot afford beyond Medicare. It also helps protect your retirement income you work so hard to save up. Why should you have one of these? Well, there's a deductible for an inpatient stay at the hospital or for a mental health stay. Basically, 2021, it was $1,484 for each benefit period. After 60 days of a benefit period, there is coinsurance. So basically, if you had a really long hospital stay or a mental health stay that lasted longer than 60 days, or you didn't get a 60-day break in between benefit periods, you could end up having to pay $371 up to day 90. And then after day 90, you could be paying $742 when you have up to 60 of those in a lifetime. If you use up all those reserve days, you actually are responsible for all the cost of those days from then on out. It's very rare that someone would actually use all 60 reserve days, however. There's also a skilled nursing benefit. You are in a hospital and you need some rehab stay and you can't go home, so you go to a skilled nursing facility for rehab. After 20 days, there's $185 coinsurance per day up to day 100 of a benefit period. Once again, these are 2021 costs. There is some durable medical equipment that is covered under Medicare Part A, and there's a 20% copay for those. Also, keep in mind, if you have traditional Medicare, there is no out-of-pocket limit for the calendar year. Well, we'll talk a little bit about Part B Medicare. Since we discussed Part A is generally inpatient hospital care and home health care, Part B covers mainly your outpatient services like your doctor's visits and outpatient labs. It has a $203 deductible in 2021 that was set by the government. And after that deductible is paid, a Medicare recipient typically pays 80% of the Medicare approved amount. Most doctor services, including when they see you while you're an inpatient in the hospital, are charged under Part B. For example, 2018, the most commonly coded office visit charges were $71 and $105. So you would be responsible for 20% of that cost. Outpatient knee procedure typically is between $10,000 and $13,700 is what Medicare was paying for those. So once again, you'd be responsible for about 20% of those costs. Outpatient therapy, most durable medical equipment, observation stays in the hospital. Outpatient testing is also covered under Part B. And once again, there is no out-of-pocket limit for you in a calendar year. Kaiser reports in 2016, the average Medicare recipient paid $5,640 on services, but that also included their premiums for a supplement. So looking at taking away $1,308, which is the average yearly Part B premium, that brings healthcare costs out for you down to $4,332 is what you could expect to pay beyond your supplement. Looking at if you need a Part B plan, $25 a month taken out of that also. So we get down to $4,044 for the year. And then we look at the cost of a supplement, what you actually have to pay for a supplement, figuring about $1,500 for a year if you find the right one. You could be on the hook after paying for Part B premiums, your Medicare Part D, and your supplement. You still have $2,544 available. So picking the right supplement can help cover almost all of that balance. If you have a Part F, it could cover $2,544. And if you were ineligible to buy Medicare after they grandfathered Part F, you would be responsible for the $203 deductible with the right plan. So we'll talk a little about the plans. Basically, to get supplemental insurance or MediGap, you have to have Medicare Part A as well as Part B. Open enrollment is the 6-month window starting when you are 65 and enrolled in Part B. So if you're 65 and covered under your spouse's insurance till you're 70 and you didn't enroll in Part B until then, it's a 6-month window after you enrolled in Part B. The monthly premium for the supplement insurance is paid directly to an insurance company, in addition to Part B premiums being paid directly to the federal government. Often these are taken directly out of your Social Security check before it's deposited in your bank. Companies selling plans must offer Plan A as well as Plans D or G if they offer any plans. There are a multiple of types of MediGap plans, but companies don't have to offer all of them. It helps pay some or all of the healthcare costs that original Medicare doesn't, such as your co-payments, co-insurance, and deductibles. Some plans also cover services that original Medicare would not cover. For instance, medical care when you're traveling outside the US, a lot of plans will cover that at 80%. The good about having this plan, it covers some or most of the out-of-pocket expenses that Part A and Part B don't. You are guaranteed coverage during initial enrollment period, even if you have a pre-existing condition. So the other reason you shouldn't wait to purchase one of these is if you wait beyond the 6-month window, your pre-existing conditions could deny you getting a plan or put you into a higher premium. Coverage is then guaranteed renewable as long as you pay your premiums. It's nationwide, so you can travel and you don't have to worry about finding a hospital that's in network. If they take Medicare, they will also take your supplement plan. The plans are standardized by the federal government, so they're really easy to compare. The not so good about these plans, cost. Average premiums are starting to get over $2,000 a year. Still remember, $2,500 was an estimated cost, even if you had a plan that you could be responsible for, that when you look at the average amount of healthcare costs most people are paying. So you're still money ahead by having one of these plans. Basically, when you look at a monthly charge, they could be as low as $29, but I've seen some go as high as $1,093. So you're looking at $348 a year to over $13,116. Overall, when you look at these plans, plans A, B, and C tend to have high premiums compared to the amount of benefits they pay. So basically, there are many other plans with similar or better coverage with a similar or better cost. Once you're enrolled, it can be difficult to switch. If you are able to switch, you can have a 30-day free look-back period with your new policy, and you can switch back to your old one as long as you pay the premiums for both for that month. So if you switch and you're not sure you made the right decision, it might not be a bad idea to actually pay the premium on your old plan for a month. And if you decide to switch back, you can do so easily. If you're not enrolled during the initial enrollment period, the plans, as I mentioned, can deny coverage, charge higher rates, with the exception of some guaranteed issue rights that could apply, which I'm not going to go into details on those. They can be well researched in the Medicare website, which I will kind of point out how you could find those. The other thing about this, unless you happen to have Plan J, which is a grandfathered plan, so unless you purchase Plan J and have it, you're not eligible to purchase it as a brand new plan. You still need to buy a Part D plan to have medication coverage. Basically, there are multiple types. They have letters pretty much ranging from A through N with a few letters skipped. F, G, and J have high deductible plans available. So you have a much lower premium, but you have to pay a higher deductible before they start to cover. In Plan C, F, and J are grandfathered. So if you are new to Medicare, you are not eligible for these, but Plan D and Plan G are very close to Plan C and F. They also have what's called select plans. These tend to be cheaper plans, but they have approved networks. So now that freedom to go anywhere in the country, if you have a select plan, is free because you may have to pay a 20% out of network when you travel. Plans A, B, K, L, M, and N generally have more out-of-pocket costs for the services you receive. And note that N has some set co-pays after deductible, like a $20 office visit and a $50 ER visit. So if you have a really good premium, Plan N might be a very good plan to look at. Plan C, F, and J actually pay the Part B deductible. So if you still have one of those and continue to have one, you don't have to worry about, you would not have to have paid the $203 this year. And I anticipate that deductible will probably rise next year. Plans F, G, and J also pay Plan B excess charges. So surgeons can charge beyond what the Medicare allowances up to 15%, and you would be responsible for that. But if you have a plan F, G, or J, they will also cover that for you. In 2021, studies have shown Plan G was the most popular plan purchased by consumers of these. The high deductible plans are, I think, very interesting for the cost. Looking at 2020 deductible of $2,370. Plus, if you had the Part G plan, you had to pay the additional Part B deductible, so add about $200 to that. And then you get much cheaper policies of looking at $29 to $174 per month. Whereas if you had the non-high deductible plan, you're looking at $93 to over $1,000. So as you can see, there's a potential for big plan premium savings for these. The significant plan differences is Part A does not cover that Part A deductible when you're admitted to the hospital as an inpatient. So if you have Plan A, expect to pay that approximately $1,500 if you were admitted to the hospital for an inpatient stay. Plan M covers half of that, so you would expect to pay about $750 during that stay. At a range of $70 to $838 per month, I strongly question the value of Plan A, paying pretty high premiums, and if you were hospitalized, you still have to pay $1,500. And then if you're out of the hospital for more than 60 days and return to the hospital, you once again would have to pay $1,500 if you are admitted as an inpatient. Skilled nursing facility benefits are not included in plans A and B, another reason why I question their value for the premium you're paying. Foreign travel emergency is also not covered in plans A and B, as well as K and L. So if you travel out of the country, those plans may not be the best choice for you either. Plans K and L do have significant cost sharing with the consumer, but they also have yearly out-of-pocket limits. So Plan K, you pay 50% of that 20% that you have to pay until you hit the out-of-pocket cap of $6,220 plus the Part B deductible. So in 2021, it's really $6,423. You would pay no more than that on Medicare approved charges. And L, they pay 75%, leaving you 25% of that 20% to pay, with an out-of-pocket cap of $3,110. Looking at plans K and L, I often think that if you get a really good premium, you very well may be better off with the G high deductible plan. If you happen to be admitted, that $50 copay for N is happen to be waived. Plan J, if you still have it, you also get preventative care of $120 allowance a year. And you can also get some at-home recovery benefits at $1,600 a year, as well as prescription drug coverage. I will warn you, the premiums on these plans have been rising considerably, which is the other reason many people no longer keep this plan. Mentioned considering that high deductible plan. Plan G can cost up to $8,736 a year in premiums, or $728 a month. Plan G high deductible could cost up to $2,052 a year in premiums, or down to $171 a month. That difference of $6,684, if we look at the maximum amounts, far exceeds that deductible of $2,370. If a Part G plan has a premium difference of $197 or more than the high deductible plan would be a better choice. If you are thinking this route and you're planning ahead, use a health savings account and put about $5,000 aside to cover deductibles. As you use money out of this, you can replace it. So if you have a very healthy year that you don't spend a lot of your deductible, you can put some of that savings back in that health savings account. If you are healthy early and have little Part A and B expenses, there's a whole bunch of savings potential here for you, while having the peace of mind as your health declines and your healthcare access increases as you get older. You still have a really good plan that covers well after you meet your deductible. Comparing plans, basically, I'm going to show you how to compare plans on Medicare.gov. It's a great site. There's no pressure from an agent trying to sell you one plan or the other. They're just giving you the information, then giving you links to access those companies. And there are pretty much three things you need to consider when looking at these plans. One is a community rated plan. These have the same premium regardless of age. Premiums may go up based on inflation and other factors, but not age. If you end up signing up at a later age, this might be a really good choice because the 85-year-olds have the same rate entering as the 65-year-olds. There's an attained age rate. This is low for younger buyers, but as you get older, the premiums go up. In addition, inflation and other costs will also rise those premiums. So I buy this plan at 65. I can expect it to be considerably higher when I'm 85 to 90 years old because it's based also on age. This plan looks really promising for people that are new into Medicare and still coming in at a young age. The issue age related or entry age related plans. The premium is based on the age you first entered. So the lower age you are when you buy the plan initially, that's the rate you have. And then it is adjusted again based on inflation and other factors, but not on age. So young buyers looking for the first time, I really suggest you look closely at the age-related plans. The attained age-rated plans may have the cheapest premium, but remember that's going to rise considerably as you age. Some plans offer discounts if you're a woman, a non-smoker, married, paying yearly, paying using electronic fund transfers, or having multiple policies with the company. So where you get your home and auto insurance, you may want to see what plans that company may offer if they do offer Medicare supplement plans. Your insurance agent's a great resource. Also, ARP plans if you're a member, and there may be some other memberships you have that give you discounts for supplement plans to consider. We're going to go ahead and go to that Medicare.gov site. Okay. All right, so we're now at the Medicare.gov website. And remember, it's Medicare.gov, not Medicare.com. Medicare.com is actually a site where you'll get linked to brokers and they'll be looking to sell you Medicare Advantage and supplement policies. And there may be some pressure on you to buy a particular one over another. This one was put together by the government and it's very easy to compare plans. From this plan, you can actually just go find plans. And you can log in and create an account, or you can just continue without logging in. I often think for comparing supplement plans, there's not a lot of reason to go ahead and log in. As you can see, there's a lot of options if you're new to Medicare. And right here, we're going to look at Medicare, MediGap policies only. If you're brand new to Medicare, you can actually shop Part D and MediGap at the same time, but we're just going to look at MediGap policies. So select that, and it mentions that it pays most of the cost original Medicare doesn't cover, plus some other cost. And you'll get to see price ranges, and you'll be able to contact the insurance company directly to enroll. These plans, once again, are based on zip code, especially when you want availability of select plans. That does make a difference. So since I live in Dixon, I'm going to go ahead and put in the Dixon zip code. And then if you really want to do this well, I'm going to say I'm a 65-year-old male. I'm a little younger than that, but most people will be 65 when they're first enrolling in Medicare. I'm a male and I'm a non-smoker, so I can put in my update prices. And you can see for me, Plan A, 78 to 332, tells me that shows me what my deductibles are and what is not covered. I can view policies and get more details that I compare to other plans. I've done a lot of comparing that I will not be looking for myself for a Plan A. Also keep in mind a $78 premium is the cheapest. I'm going to scroll down to Plan G. 78 for Plan A. Plan G is 107, so it's about $30 more a month, but I have no hospital deductible. I have skilled nursing benefits. Once I pay this $203 deductible, it covers everything that Medicare wouldn't. Any balance left from Medicare, it will cover. I also can look at what a deal I can get on the Medicare plan, the G high deductible plan, getting a premium as low as $33. So this is the most popular for a reason. And this one, if you're financially savvy and have some money aside to help pay your deductible, it's a really good plan to look at. As you can see, K has some pretty decent premiums, L a little bit higher, but it pays a little bit better. So you can kind of get a good idea. But we're going to go ahead and just look at the plan G since they're the most popular, and I'm going to just click view. And it's going to show me a bunch of plans. It's also going to tell me that the company's selling this policy, and I can scroll down to review results. And this one, they even tell you this is community pricing. So once again, if I'm 65 or 85, I have the same price when I go to sign up. Attained age pricing. This one, I'm going to get a really low price because I'm 65, but as I age, this price is going to go up quite a bit. I'm going to scroll down a little bit further and find the issue age pricing. This one, whatever I pay as my premium based on age now, will be the same when I'm 85. The only difference will be some cost of inflation and cost of living increases that get added with about everything in the world. I happen to be a State Farm customer, and if I scroll down, I can tell you they're way down there, alphabetical, but they're attained age pricing. So I'm likely not going to stay with the same company I get my home insurance through, because as I age, my premiums are going to start climbing. So I don't think my discount for being a State Farm customer is going to help make that difference. So I'll just scroll. I'm looking for those issue related, like Everensence. And I will tell you, these companies generally are very reputable. And then if I really wanted to get more details on the exact cost for this policy, I'd have to visit the company website and contact them directly. So I would probably, when I want to confirm these, is get the information for the issue age pricing as I'm going in young and expecting to live quite a few years beyond 65, and kind of compare a few of those. And you got to compare them at the actual company sites, so it's not quite as user friendly, but it's still pretty easy. If you were signing up for one of these because you were 82, because you no longer now had employer coverage that you were getting for a while, you might like that. First one I was looking at the community-based, because you're going to have a higher premium if you use the other ones that are based on age. So that's pretty self-explanatory. Once you get to the site, I think the site makes it really, really easy to look at and gives you a good idea of what premium ranges you're looking for based on the plan letters. And as I said, most popular is Plan G, so most Americans are looking at that. So I would suggest you kind of look there and then compare a few others like the high deductible and Plan N to see if one of those meets your budget better. And remember, I really recommend you probably ignore plans A and B, because if you end up admitted to the hospital or need to go to a skilled nursing unit for rehab after a hospitalization, you're not going to like your coverage. In conclusion, a Medicare supplement can help secure your retirement funds. It's basically going to cover that 20% of what Part B does not cover, or those deductibles for Part A, or that copay for long skilled nursing stays. What these plans cover and the cost of these plans can vary significantly. $29 to well over $1,000 a month. That's a pretty significant change. They're very easy to compare through Medicare.gov to determine, if the G's or the A plans or the M plans are right for you, and then to look which ones are community-based pricing or age attained or age issued, and then give you links to the actual companies to actually get the actual costs for you from there. If you cannot afford a supplement and do not qualify for programs that cover the deductibles or the 20% balance, such as Medicaid, or if you're in a QMB, you may want to consider the Medicare Advantage plans, because there are many of those that do not have premiums out there. Keep in mind there are more copays with Advantage plans. An inpatient stay could still cost you about $1,500 if you're in for 5 to 6 days. The copay per day ends up being about $1,500. If it's a 2-day stay, it's definitely going to be closer to $600. There are more pre-authorizations. Sometimes they deny traditional services when they're reviewed. So such as a skilled nursing stay for rehab may be denied by this, and then you either have to pay out of pocket. You can try to contest it, and a lot of them still get denied, and then you ultimately have to find alternative choices to care. You have network limitations, so maybe you wanted to go to rehab and they approved it, but the facility you want is not network and you have to go to another one. And the other thing with pre-authorizations, standard care may be delayed while waiting for authorizations. Stress test needs to be approved by an Advantage plan and does not have to be approved by traditional Medicare. So there are times that you may have delays in care by picking one of these Advantage plans. If you have any other additional questions, you may add them in the chat below and we will sort them out and get back to you, or you can leave me an email at jbrusky@ksb.hospital.com. You can also try my desk extension. I'll be honest, many times I'm not always at my extension, but I do return messages pretty promptly. Thank you very much for joining me on this presentation and hope you find it beneficial.